that are going to be team members.
I'm on this side.
Okay.
Yeah.
All the functionality, RT, the job is just to look at needed you and keep the relationship with the head.
I'm going to have you guys go ahead and put an extra flat sheet under the patient, though they already have a draw sheet. Put another one under there.
Are we doing this as returning, or are we doing
No,
this
she's
before?
saying that if the patient has a draw sheet, we still need this, right?
Yes, you're going to need it.
I can double. Yeah, but I asked to put it before.
Yes,
Or
try
as
to get
returning patient.
try to get everything ready.
Okay.
So what you're going to do is you're going to have ABGs an hour before you prone, and an ABGs an hour after. And you're always checking the vital signs to make sure, obviously. So with your bony prominences, that's why you're going to have the Methylex. You're going to put some on your knees and then the top of the feet.
The knees?
Yes.
The knees.
Yes, and any other bony prominences that you think you might need some. Okay, so you're going to get this ready as well, and you're going to get your pillows ready.
How are we getting them ready?
So the pillows are going to go, one is going to go on the chest, one is going to go on the pelvis area. You're going to keep the abdomen open, and then one's going to go down there by the feet. Exactly, so you have those all ready. The other thing that you have to have ready is your EKG leads, because you're going to have those for the back side. These are going to hook up to the back. You're going to go ahead and get this ready on here, because you're going to turn the patient. You might want to put it under the pillow, actually.
I'm putting it so.
Yeah, for, you know, if they have an accident, because they're going to be on their
Here,
stomach.
flip it over.
Oh,
There you
okay,
go.
because they're going to be on this one.
Yeah.
Okay, right.
And then you're going to need one more sheet here to go on top
Of everything.
of everything. And then you're going to
We're gonna
make
make a sandwich on it.
a sandwich.
Don't do this anymore.
Hungry.
Peanut butter and jelly.
I'm getting hungry.
You might need a little bit bigger. Like,
Full.
yeah, because you're going to actually roll. You're going to roll these together like this.
Oh, I'm getting
You're going to roll on your side as well. And this is a team approach. So you're going to have a leader that's telling you there's steps. So you're going to do 1, 2, 3, maybe 4. But each step. So you're going to move the patient completely to, which side do you want to go? Is it?
You want to flip him towards the ventilator side.
Yes,
So assuming
towards
the
the
vent is on this side, we're going to have to turn him so right.
Yeah, there you go.
Good leader.
There are 3 on this side. One of you step
It
up.
really should be 2, but
Y'all
we're gonna
step
be
up.
the
Well,
chest tube.
she's,
Lead.
she's the chest tube that
Yeah.
Be the
helps you.
boss.
Okay, so that means that we go over here like
When we
this.
turn him, we stop when the patient is completely on their side. So we don't flip him, we take one step and like a
At a
pause
time.
and recess. So
that means we
correct
go-
me if I'm wrong, as you're pulling, you're actually pushing down, right? So
Yeah.
we
Okay,
just turn,
so
we cannot
Oh,
turn,
okay,
we cannot rotate.
Okay.
Otherwise the patient may kind of fall
And
to
you
the back.
may actually need this extra sheet under. That's why you're if you can't get them completely. So go ahead and try it.
Okay, so we're being slowly pulling, they're slowly pushing and returning, and we're still pulling,
Right.
and then
And
pushing.
then
Stop.
And then
Stop.
you kind of, exactly, you stop at this moment, and then you go home and then come back up.
Okay, okay, okay.
Wait till I'm
Because
finished.
we can see it down here, then. Or no, because you're gonna take the lids off.
Yeah,
the chest,
somebody could take the leads off. Well, we don't have them on here. Well, pretend we took them off.
We took them off right before
This is
turning.
pretty cool.
And then go ahead and you'll have your other things ready.
So they're still in a sandwich, but now we're going to unwrap the sandwich to put the leads
No,
back on.
no.
Can we do it there?
Oh, actually, no.
No, we're just taking off this. We're not
Taking
putting
off the
stickers
leads.
on until we get them back turned over, right?
Now, Mel had a really good point the last time. Is before you even start, to actually put the leads here and here and here before you even flip. So the only thing that you have to deal with is the V lead. So
That seems like a lot. I don't, cause I don't.
Okay, can we just?
Okay.
Let's finish up.
Alright, so we flip, we continue to turn.
You pushing and y'all pushing, now we grabbing here, I guess.
She just started.
Stop.
So now,
Our patients never die, don't say that.
Yes.
if you needed to, you could put a check under here, and you could put the foam or the saline pack here to try to do like a little bit of a water bed because of the tube. Okay?
Some patients are bigger, some patients have less bigger neck, the shoulder is stiff, your neck never has a very good neck, so that may vary patient by patient.
Okay.
And when we have to talk about the arms.
Yeah, the arms. We'll talk about the arms.
So you want the arm that's facing the face to be up, so they're facing like this. You want this arm, the other one down, and then every 2 hours when you're assessing, you kind of flip the head, and then you switch the arms. They're doing this every 2 hours. Well, they're doing it somewhere.
Okay.
So,
Now that she's
should be
facing
the-
this way, we would actually put this arm like this. We would have to kind of.
let me see if we can
Raise
do
the
it.
arm of the face that's like
Right.
holding. Oh, but that's kind of scary. I hope they ain't gonna pull out their tube. How we gonna restrain them? And what
This
is,
patient starts with the paralyzed.
huh?
If your light is on, this patient should be paralyzed.
Okay.
So they shouldn't be coughing or pulling stuff when you're doing that. Should be just like, just that way.
Okay.
And then you would, like you were explaining, you would make sure that the pillows are in place so you're kind of, as much as you can prevent,
put the leaks.
pressures.
Yeah, and just make sure the arms, like maybe you just roll up maybe another towel or a blanket, just to make sure that you have the support you need, because this person is paralyzed, and you don't want them to have any kind of,
Pressure ulcer.
not pressure ulcers, I mean, just like,
Contraction.
like hurting your
uncomfortable.
brachial plexus and all of those other things that happen with you, and that you need rehab after we've done this to you.
And then 2 hours later, we would, with a team in place, you would drop this arm, raise this one. You can probably shift a little bit to help us enough so it's easier to have it upward, and then feel the head.
Yeah, so we can turn her head. Excuse me.
This what?
The leg, and then we put this like holding probably in a something that's not gonna be.
What's it holding?
It can be like a water pillow. So you can put it like maybe in a pillowcase or something. Take 250 mLs out, and then it's just enough to be like a water pillow, so that
It can help you put pressure.
To
in the
decrease
face,
pressure,
on the head,
ulcers,
or in
and
this
things.
general area.
Okay, it's a pillow.
I do recommend that when you do an A-line, you actually disconnect the A-line, right?
yes, the
But the chest
A-line.
tube, you really try to keep it unchanged, otherwise.
The other thing to think about is if they're male, if they're positioned correctly, and if they have a femoral line. We need to make sure that those are also
So we could
secured.
How,
Well, not
what's
only
the
is it
longest
secure, how do we assess
period of
those
time
sites?
if they tolerating it? That we could keep them in this position with the rotating the arm every 2 hours.
16 hours.
They could, as long
So
as they're
they're
tolerating
on their
it.
bottom floor, and then you flip them back for the
Okay.
remainder of the
That's
run.
the goal.
And then at that point, you assess if they need to go back.
Okay.
That's done through vital signs and through EBG.
Okay. Hoping that they.
Typically, when you prone them, their sets improve like an hour or 2 later. It's not immediate, but you should see an improvement in the ABG and also here. And then when you flip them back, they go back, they worsen a little bit. And if they worsen a lot, you prone them again. When you put them back on their supine position, their drop is very modest, then that's how you can tell that you don't need to prone them one more time, so you stop proning.
Okay.
The
Also,
other,
usually people just prone one time. For 16
No,
hours?
Usually it's days, maybe 3, 4, 5 days.
Oh,
One is kind of unlikely.
oh. So it's 16 hours, and then flip them back for how long?
And you flip for the rest of the 24-hour frame.
Okay.
So 6 hours in one 24-hour.
Another 8 hours.
And so it is most effective to do it 16 hours at a time instead of 8 and 8.
And it-
There's different protocols.
Mean like
There's people
8 in the
who do
morning, 8 in the
12,
night.
14, 15. There's no comparison between which is better. There's a lot of depends also on the actual practice, like what time you do our report, RT. I mean, there's always some house to house. But in general, about 12 to 6 hours per day, that's the average time most institutions will do it for.
here, talk about the
I'm putting this on the group meet for the
Oh,
night
so like
people.
what happens, we start
You know.
coding like in this position.
We
don't
code
have-
in this position.
Until you can get them repositioned.
Right, so you need
Let's
to have
start.
a team, right? So the code is typically you have to call for help, but the actually CPR can be started like this. And if we have a true COVID patient, we do not, I cannot stress enough, we do not bag unless, let's just say we don't bag. There's very few exceptions, but those should be case by case, but the norm is to not bag. So don't start, if you see her doing it, please remind to not, for everybody's sake, theirs. So we just ventilate to the tube, it's in there.
The pillows and stuff, that all waits until we get the team to reposition them. We're CPRing even with the
We're
pillows.
CPRing the
We're
rest of
still
the
gonna
guys
have
in
the
back.
board under them, should be, right? Yeah.
So
Well,
there's
just
it's
don't think
documented.
that, just
That
be,
you-
remember that you can start in this position.
Mhm.
You're gonna do everything that you usually do, so.
Mm-hmm.
Right, but when the person gets here, you call for help and then you start. So don't try to obviously start to do it. Just wait till the whole team gets here, and if they make it, great, and if they don't, they'll rest in peace. But yeah.
No, rest in peace, Coney.
Yeah.
Well, I mean, don't try to do anything heroic. I mean,
Right.
if we try.
Okay, I
this is
need to
already
go get my
heroic
patient
enough.
medicine.
It
It's
is,
like,
in my opinion.
And then I have some information on documentation on this particular one.
There's a video link, I believe.
I have the
which is
video
very good to
link.
see it a few times because